Hello. Today's lecture is on patient teaching. Some of the basic objectives of today's lecture are to review the components of a patient teaching plan, discuss learning principles of patient teaching, and to look at nursing diagnoses that are specific for patient teaching. One of our roles as an RN is that of teaching. Teaching care plans are the responsibility of the RN. So what is it? It's the communication of facts, ideas, skills to change knowledge, skills, attitudes, values, and behavior of patients and families. And the purpose is to enhance the client's ability to achieve a higher level of wellness or to manage specific healthcare needs. Please remember, your client can be the patient, their family, or a target group. As RNs, the Oregon Nurse Practice Act, under the RN standards, charges that we develop and implement evidence-based education plans that address the client's context of care, learning needs, readiness, ability to learn, and culture in order for the patient to achieve optimal health. And that we evaluate the outcome of health education to determine effectiveness, adjust teaching strategies, and refer patients to another licensed healthcare professional as needed. So how do we as RNs do this? Through individualized teaching care plans. An individualized teaching care plan is a carefully written, organized presentation of what the patient or caregiver, family, or group must learn and how the nurse will provide the instruction. It is teaching what is essential for the patient to improve the patient's welfare. It involves the nursing process of assessment and analysis, diagnosis, planning, implementation, and evaluation. In patient teaching, there are several different components that need assessment and analysis. The first is context. There are two types of context to consider. One is a situational context. This is a situation that creates the need for education. And the second is the instructional context. These are the contexts and the conditions on which education will occur. It also addresses when education will occur, such as in the hospital or at the office, and the time frame for the nurse. When in her shift are you going to be able to do it, and how long is needed, and how long are you going to have to be able to do it. You also need to assess health literacy. Health literacy is an important step to determine how and what needs to be taught. So what you want to know here is, what is the patient's healthcare background? What is the ability of the patient to be able to read, understand, and act on health information? Asking what information has already been provided to the patient will help to determine not only their readiness to learn, but also what information they have already received and understand. Taking a look at learner demographics is very important, because various demographic characteristics can influence the learner's response, including language, age, education, and culture. You will need to assess their learner capabilities in the category of capabilities and barriers. So it's really important to start with this, because we need to know what could be in the way of the patient being able to learn, such as, are they in pain? Do we have cultural considerations? Is there a language barrier that we need to address? We also want to know in this situation, what is the patient's preferred learning style? This is the way in which the learner processes learning, and there's three basic styles. One is visual, where they need to see it, auditory, where they need to hear it, and psychomotor, where they need hands-on learning for the education to have meaning for them. Whenever possible, you want to accommodate the patient's preferred learning style. So for example, for an individual who has a visual learning style, you want to give them handouts and videos, and that's effective for them. For the auditory patient, having discussion groups, panels, or verbal instruction works very well. And for the patient who is very psychomotor, demonstration, practice, and turn demonstration are very effective ways to teach skills. You need to take a look at what is their physical readiness. Is there a physiologic impairment? Are they medicated? Are they in pain? Are they cold? Is there a sensory impairment? Do they need glasses or hearing aids? Or is there a psychomotor impairment? Are they physically able to perform the action that you're asking them to do? Emotional readiness and stress needs to be assessed. Adjustment to illness and outlook on life needs to be determined as to where the patient is in their disease process. Also, is the patient undergoing any kind of a stress, whether it's emotional, financial, or spiritual? If a patient is not emotionally ready or stressed, then when teaching is taught, it will not be assimilated by the patient, and you will have to redo your teaching. Or the patient will only receive bits and pieces, which would lay an erroneous foundation knowledge for the patient to work from. And you'll have to correct this then. You'll want to assess what the patient's compliance potential is. What issues could reduce their ability to be compliant with what you're going to teach them? Compliance can be lessened by things such as financial problems, if they're worried about how they're going to support themselves, make money, pay for the hospitalization. Inconvenience, whether it's something as simple as, is this not the correct time to teach because it's the patient's favorite TV show or family are visiting, or that the patient doesn't understand how they can incorporate that in a more convenient way in their lifestyle. Is the patient in denial? Are they refusing to accept a difficult diagnosis? They understand they have it, they just don't accept it. Is there a lack of social support? Does the patient live alone? Are they able to drive? Non-acceptance of the disease. This goes hand in hand a little bit with denial, and that they refuse to accept the fact that they even have the disease. And the last one, finally, is anxiety, fear, shame, or negative self-concept, which may be associated with the disease process that you are needing to teach them about. Cultural considerations and health beliefs need to be looked at, so it's important to consider these. With religions, you have to remember in some cultures the male makes all the decisions. For health beliefs, you need to find out whether or not the patient believes in other health beliefs such as Chinese medicine, or something else that is a non-Western medicine. You need to find out whether or not the language is a barrier for you. If not, you may have to have a facility-appointed translator come in and do translating so that you can document that the patient did understand because it was a facility-approved translator. And then you need to find out if there are any sex role beliefs. Remember, in some cultures, women are not able to make any decisions for themselves. And in other cultures, women make all the decisions when it comes to health. So you need to find out about that. Potter and Perry in your reference book, and this is the fundamentals book, has a good box on 25/7 for tips for handling cultural considerations. Other examples that can affect health behaviors in teaching, if you remember, under religious beliefs, you have Jehovah's Witnesses who do not accept blood transfusions. Individuals of the Islamic faith do not donate or receive organs. Native Americans and Chinese practice and trust folk medicine belief over Western beliefs. And for many cultures, again, women are the only one to prepare the food and care for the ill at times. And again, as we said before, some do not have a say over their health care. When planning for teaching, one needs to remember that some learners fall into special groups. With the adult learner, you want to start with what they want to learn. This is what they're most interested in. You need to try to help them understand how learning will help their situation. And most adults also learn best by doing. For them, it gives the action meaning. In the older adult, you may need to modify the teaching plan by presenting it slowly. This will help to accommodate for the normal sensory changes that are associated with aging. Potter and Perry reference box 25-8 has more information on how to help plan your teaching to the older adult. With children, you need to teach according to their developmental age. Remember, most children, when hospitalized, regress in their developmental age. If the patient does demonstrate regression, you want to adjust your teaching plan down to that regression and then readjust it upwards as you are able. Dolls are frequently used as visuals for children because it gives them something that they can understand. Also, do not forget that you have the parents who are part of this teaching plan, and so you'll need to address them also. For low literacy or learning disability individuals, the nurse needs to sequence information in the way that the patient will use it. In assessing the level, as with all teaching, this is going to help determine what instructional strategies you're going to be able to use for these individuals. You also want to keep instruction simple and do not deviate during the teaching plan, as this confuses the patient. If you think of something that you need to relay to the patient, you need to have that at the end of the sequencing so the patient doesn't get confused. Also, with these individuals, the reference box 25-3 in Potter and Perry has very good information for this population. Once you have done an assessment, then it's time to do a content analysis. During this phase, you want to identify what specific information the education should address. You want to determine which essential information needs to be shared. And you want to determine which content domain is the basis for sharing this information. If you remember, there are 3 domains. A cognitive domain is centered on knowledge, a psychomotor domain is centered on skill, and an affective domain is centered on attitude. Understanding which domain is the basis of your education will help to plan the content for your education and the interventions needed for teaching. Again, Potter and Perry in box 25-2 has some good information when determining content domain. The next step in the nursing patient teaching plan is diagnosing. Which teaching nursing diagnosis applies to the patient? Is the learning objective the primary problem, or is it an etiology under another priority nursing diagnosis? For this lecture, we're going to be looking at it as if it was the primary problem, and there are nursing diagnoses that are specifically used for teaching. Teaching learning diagnoses can fall under knowledge deficit or health management ineffective self or ineffective family, and health management readiness for enhanced self. Some less common but equally, noncompliance back up there. Some less common but equally appropriate teaching and learning diagnoses are therapeutic regimen management, ineffective community, also ineffective family can be used here, therapeutic regimen management effective, health management readiness for self, development risk for delayed, growth risk for disproportionate, and health maintenance ineffective or health maintenance impaired. Just as in the development of nursing diagnoses for other problems, in teaching one needs to establish the priority of learning need. For review, they are, is it immediate? Does it need to be taught now, or is this something that can wait until later? Specificity, how does this relate directly to the patient? And necessity, is this something that they need to know, or is this a nice to know? So let's talk about a couple of those nursing diagnoses that we listed before. The first one is knowledge deficit as an etiology. So a knowledge deficit can be the underlying cause of a health problem for the patient. In these cases, the knowledge deficit can be written as the etiology of the nursing diagnostic statement. An example would be imbalanced nutrition, less than body requirements, related to mother's lack of knowledge about infant feeding and deficient learner readiness, evidenced by mother's quick frustration when breastfeeding, declining to engage in learning process, and recent lack of infant weight. Another nursing diagnosis is noncompliance. Noncompliance is an acceptable diagnosis in this area when it comes to teaching. What it refers to is the patient can return demonstrate skills accurately or verbalize the regimen needed, but makes a conscious effort not to follow through on care. They are consciously not doing the skill or behavior. In other areas of nursing with a nursing diagnosis, there is a reason for the patient being non-compliant, so we have to look for what that reason is, which would be the more appropriate nursing diagnosis. But in teaching, you can have non-diagnosis as a conscientious action on the part of the patient. So when you're looking at non-compliance and you're looking at your related to factors, you're going to see things like patient value system. These involve the patient's health belief, their cultural influences. They may not be the same as ours. Fear and anxiety. They may not want to do it because if they ignore it, they don't have to deal with a potential bad diagnosis. They could be depressed, or they could have difficulty changing behavior due to addictions, decisional conflicts, family conflict, or excessive demands that have been made on that individual or family. Some defining characteristics that would show noncompliance are statements made by the patient, such as the patient does not perceive the illness to be serious, or they don't believe that therapy will help, or they're not willing to follow through on the treatment regimen because it's inconvenient, they don't have time, finances, whatever the reason. Or another characteristic would you can directly observe the patient failing to adhere to the treatment regimen. This is a patient who is supposed to be NPO because they're going on a procedure, or if they have pancreatitis, NPO is one of the ways to help the patient decrease their pain, and you can walk into the room and catch the patient drinking out of the sink. You can observe failure to progress in the patient. They're just not doing very well, and they should be if they were following their regimen. Evidence of developing complications or exacerbations of illness. A patient is not taking their respiratory medications, so they wind up coming into the hospital more frequently because of exacerbations. You can have mistrust of the regimen or healthcare personnel. This is very frequent when it comes to individuals who are different cultures, who have different health beliefs, or who have had bad experiences in the past with healthcare personnel. Or it could just be due to powerlessness that the patient is feeling. So once you have what you're going to teach, then you need to come up with your learning goals in the planning phase. So learning goals are made up of terminal objectives and enabling objectives, which are going to define what the patient will be able to do as a result of your teaching. So it identifies specific and measurable behavior. It identifies what the nurse will teach, and it provides a basis for evaluation. Client involvement in this is essential, and box 19.8 in Patter and Perry have a lot of good information. So, when we're planning learner outcomes, when it comes to patient teaching, your outcomes usually fall in one of three areas. Information about the disease process, learning about medication, or learning about the treatment regimen. So what are terminal objectives and enabling objectives? A terminal objective is a very broad goal. It's going to identify major behaviors that contribute to achievement of an overall session goal. They're very broad, they're encompassing, and they're going to contain under a broad umbrella all of the steps and interventions that would be needed for the patient to be able to achieve their outcome goal. An enabling objective is a very narrow goal. It's going to identify secondary behaviors that contribute to or enable achievement of tertiary objectives. So they're much more specific to achieving behavior changes. These are the steps that the patient is going to work through and accomplish to be able to meet the overall terminal objective. So let's look at a couple of examples of terminal and enabling objectives. If we were looking in the category of medication, upon completion of the teaching session, the patient will be able to manage his or her insulin therapy. That's the last one on this slide, and although it's not at the top, I chose to start with that because that is a very broad terminal goal. So, managing insulin therapy encompasses many steps. Can they take a blood sugar? Can they read a sliding scale? Do they know the signs and symptoms of hypo and hyperglycemia? Can they administer insulin, etc.? So it's very broad and terminal. Now if we go back up to the top of this slide, the next one is upon completion of the teaching session, the patient will be able to describe the purpose and side effects of insulin therapy. Again, you can see that this is a narrow objective. It's enabling because we're only asking them to describe the purpose and the side effects of insulin therapy. We're not asking them to do any of the other components I listed would be part of the broad. And finally, upon completion of the teaching session, the patient will be able to list signs of hypoglycemia. Again, narrow, enabling. It's a very specific thing that we want them to do, and it does not encompass all of the learning they would need to do about insulin therapy. So let's look at treatment regimen. Upon completion of the teaching session, the patient will be able to manage his or her blood glucose without assistance. Now this is narrow, and the reason for this being narrow is we're looking at blood glucose. So that means, can they do a finger stick? Can they understand how to use it and where they would identify that that would be on a sliding scale, and therefore know how many units of insulin they're supposed to draw up. So it's a very specific step. Upon completion of the teaching management, the patient will be able to manage the treatment regimens of his or her diabetes. This one is very broad. It's a terminal objective. It encompasses everything that the patient needs to know about diabetes. We're talking about diet, exercise, blood sugar reading, insulin, side effects, etc. So it's very broad and terminal. So when planning teaching content, you need to try to decide what to teach the patient, and there are many resources that are available. One resource are what's called content outlines. So these provide specific information that the nurse should consider when teaching patients with a specific disorder. For example, if you have something like diabetes, it would cover all the different steps that you want to make sure that you don't forget to leave out when you're teaching the patient. So it would cover everything from counting carbs to how to do your blood sugars to side effects to foot checking, etc. Everything if you were going to do diabetics. So the content would have everything that you would need there to be able to teach your patient. So you can look for these content outlines in a variety of places. They can be found in textbooks, standards, drug handbooks, and nursing care plan books. Also, a lot of times facilities now have content outlines that are on their intranet websites that they have determined are the acceptable teaching that the nurse can do for their facility. So they're a great resource also. So let's take an example of a content outline. So in this one, they're talking about what we want to do is teach instructions regarding safe and appropriate oral anticoagulant therapy. So we want to make sure that when we teach the patient, whether it's in one session or over several, to take their anticoagulants at the same time each day, to wear identification stating that anticoagulants are being used, to not take aspirin or ibuprofen as it will prolong their bleeding, to use a soft toothbrush or electric razor to prevent damaging tissue and causing bleeding, and if they are cut, to apply pressure for 5 to 10 minutes as it's going to take longer to coagulate. Now this is not a complete content outline, it is just an example of some of the things that you would find under a content outline, and you would take in a learning session one or several of these depending upon your patient's ability to take in the information, and you would teach them throughout their hospital stay. So, teaching methods are used when teaching patients. These are ways to help the learner learn and retain the information to be learned. And there are 4 methods that are utilized in teaching. The first is instruction and explanation. This is good for groups, which is happening more frequently in the hospital. Sometimes patients, especially in bigger hospitals, if you have more than one patient with the same type of thing, they will send patients down if they are able to have group instruction. Another one is discussion, which is also good for groups. Demonstration, practice, and return demonstration is good for learning skills. And then you have media, which is written or technological, and the media is mostly used for reinforcing teaching, and it gives the patient something to refer to when they leave. It is important, however, if you're going to use media, that you review them prior to using them to making sure that they are accurate and that they are relevant for the objectives that you want to teach the patient. You don't want to give them something that's going to cloud the water and make them more confused when they're trying to learn new health information. Teaching interventions are the reasoning behind the specific action to be implemented. So there are different teaching interventions and different types of interventions that can be used in all aspects of nursing care. You have assess and monitor, where you're doing focus assessment, I's and O's, and lab values. You have therapeutic interventions, such as administering medications and treatments. You have preventative medications. This is going to help avoid complications and how the patient can do that. But for teaching, we're going to do the teaching interventions. So these are knowledge and skills patients need to maintain or enhance their health. For example, you have for your patient the nursing diagnosis of fluid volume excess related to renal insufficiency as manifested by weight gain, peripheral edema, elevated blood pressure, and decreased urine output. So an intervention that you could have in order to help address this nursing diagnosis is, at the beginning of the shift, explain to the patient and family reasons for restricted fluid amounts per day and how to divide that restricted amount over a 24-hour period. When developing teaching interventions, usually there needs to be a rationale for why that intervention was chosen, and that rationale is going to contain 2 parts. You're going to have your rationale for your choice of teaching method, such as in relation to the patient's learning style and or type of content to be taught. And you have a rationale for your choice of content, and that's going to describe how it will help achieve the learning outcome. This could be necessary information or skills or provide motivation for lifestyle change or compliance. So let's look at an example again. We're going to talk about medication. So our outcome for this medication example is at the end of the teaching session, the patient will be able to explain the purpose and action of Coumadin. Specific content that's going to be covered is that Coumadin is an anticoagulant medicine that prevents or slows blood coagulation. It is used to prevent thrombophlebitis, stroke, and pulmonary embolism. And the rationale for the choice of this, the method is that content is knowledge-based, and the content, and you chose this content because it's going to improve patient understanding of the reasons for medication usage, and hopefully this will enhance their compliance to follow their therapeutic regimen for this medication. Another example over the disease process, the outcome or enabling objective is at the end of the teaching session, the patient will be able to list common signs and symptoms of the DVT. The method that we're going to use in teaching is explanation and giving them the printed handout number 12, which we will review with the patient and leave with them. The specific content to be covered, we're going to talk about the common signs and symptoms of the DVT, such as calf and pain and tenderness, pain on flexion, dilated superficial veins, edema, swelling, redness and warmth over the vein site. The rationale for teaching this intervention is that with method, the content is knowledge-based, and the reason why we are teaching this content is that it's going to improve patient understanding of pathophysiological process occurring in the extremity and hopefully enable future early recognition of DVTs for this patient to prevent their occurrences. The next part of implementation is the hardest part, finding time to teach. First, like I said, you have to find the time to teach. So there's usually two ways that this is going to happen. Most of the time, your teaching is done through integrated teaching. This is done while you're doing routine care for your patient. If you wait for the perfect moment to teach your patient, he or she will not be taught. Therefore, one needs to capitalize on the, quote, teachable moment that occurs when the patient and or family asks questions as you are giving care. This will satisfy the learner with the on-the-spot and augment the teaching with more information later. Formal teaching is structured and planned. It could be in a group. It could be that augmentation that you're teaching them later in a more formal setting, but it is definitely one that's been planned. It's been structured. There's a lot of integrated teaching that goes on as you're hanging in an IV, or you're helping them to the bathroom, or they're just in the room and you're doing your assessment. That's when the patient will ask you a question about their meds or their disease or what's happening with them. So the nurse is responsible for creating a learning environment. To do this, the nurse needs to check for distractions. It's not the right time if your patient is watching their favorite show or family's coming to visit. You want to provide for privacy. This is going to allow the patient to feel comfortable asking questions that they might feel someone else would consider, quote, dumb. So you want to make sure that you have privacy and you're not going to be interrupted. Make sure that lighting is adequate and the temperature is comfortable. It's very difficult for a patient to focus or think about learning if they're sitting there shivering or they can't see because they need a light on. You want to try to avoid appearing rushed. This is a trait that you will eventually learn how to do, but you want to appear like you have time and you are truly interested and want to take the time to teach the patient about their learning session. They're much more likely to be open to learning if they feel that you're not in a hurry to just give them the information. And most importantly, you need to be non-judgmental and empathetic. These individuals come from different cultural backgrounds, educational backgrounds, and they are not usually healthcare professionals, and you need to be open to what they're hearing and what they're saying to understand, to be able to help them learn this process. The nurse then needs to actually conduct the teaching session. So you want to organize teaching so learning is logical and it proceeds at a relaxed pace with time for repetition and reflection. You want to schedule your teaching for short periods. with time for practice as needed. You don't want to have the individual try to incorporate it and not have time to practice the skill, and then you move on and expect them to remember something else. So make sure if it's a skill that they have time to practice it until they feel that they're comfortable. You want to show how what you are teaching the patient can be incorporated into their daily life. Sometimes patients need to have some brainstorming and some help seeing how something can be utilized in their life and how it can fit into their life. So we're there for that too. You want to request feedback. Is the teaching plan working for them? Do they feel that they're learning, or do they feel that they need to have something changed? So make sure that it's working for them. You don't want to spend all that time doing it only to find out that for this they needed something else and now you have to do it again. You want to remember it's presentation, performance, practice. So, and that's for the patient, not necessarily you. You want to present the information, you want to watch their performance, and you want to give them time to practice. And definitely all the time, we as nurses need to offer encouragement and praise the success for an individual who's trying to perform a skill that is not normally within their everyday scope of living. And this helps also as we offer encouragement and praise their success to reinforce that they are learning it and they're doing well. You always want to provide written instructions. These can be pre-printed or handwritten by the nurse, but this gives the patient something to go home and refer to when they cannot remember a step or they cannot remember something that you said. So your pre-printed written instructions need to be accurate and up to date. They also need to, since they are going to be used as a reference, you need to encourage the patient to write on the materials, highlighting key ideas and questions. Have them make that piece of written material theirs. It's something, as I said, that the patient can refer to when they go home if they need clarification or to review after discharge. And there's a variety of written materials that can be used. You can use pamphlets or handouts. I've seen some people draw out charts or diagrams to be able to emphasize main points for the patient. And finally, you need to do an evaluation, the most important part of the nursing process. So, because we need to know, was the teaching successful? And to do that, we have to evaluate the teaching that was done. So, this is going to evaluate our progress towards the achievement of our identified outcome. It is the RN, if you remember, according to OSBN, who's going to evaluate the outcome of health education to determine whether it was effective. Do they need to adjust teaching strategies, or do we need to refer that client to another healthcare provider? So the RN is looking to see, do they really understand? Do they know how to identify signs and symptoms? Can they perform that skill? So you're evaluating all the time, can they or can't they? So with the evaluation, how do we evaluate this? We're going to be evaluating by looking at the objectives. It can take many forms when we're looking at the objectives. You can ask the patient to recall information. Can they answer questions if you ask them questions about what they learned? And you need to put the questions in a way that they don't feel like they're on the spot and unintelligent if they're not able to answer. Are they able to perform the procedures that you taught them? Can they solve relevant problems? An example of this is, do they know how much insulin to give based on the finger stick and comparing that to the sliding scale? So would they be able to say, okay, I have a glucose of 162. I look at my sliding scale. The doctor says if I'm in this range, which this is, I need to have 2 units. So can they do that? Are they able to analyze a situation? An example of this is a CHF patient and weight gain. So weight gain in a CHF patient means that they are retaining fluid. Does the patient understand that if their weight is going up, they have too much fluid and they may need to either cut back or they make sure they take their antidiuretic if they've been prescribed one? Finally, you need to construct a plan of action. Or can the patient construct a plan of action rather? Can they adjust their carbohydrate intake based on their finger sticks? So if they have a high finger stick in the morning, do they understand that when they're looking at their diet for the day, they need to eat less carbohydrates to help bring their sugars back into balance? So based on information that is gathered during the evaluation stage, what are the next steps? So what we need to look at is, does the nurse need to adjust the teaching strategies? Do we need to refer the patient? All of those are evaluation components. And finally, you need to document your teaching. Documentation of patient teaching is one of the most important steps in the teaching process after evaluation. This is what is going to safeguard your practice. Because we all know if it wasn't documented, it wasn't done. And if something comes back and the patient says, well, she taught me, but I was too sleepy to learn, so I really didn't understand. So that's why I made the mistake and gave myself 10 units of insulin instead of 1 unit. Then if you go back in your documentation, you did that assessment, that physical assessment on the patient, and you have it documented that they were in a state of readiness for learning. So some documentation reminders that we need to remember to do. Document what you taught the patient, the time and date that you did the teaching, and who was taught. Not just the patient, but you could say patient and wife or patient and family were present for teaching. Document the physical assessment at the time of patient teaching to document that the patient was physically in a state that they could incorporate and learn teaching. You want to document how the patient demonstrated their understanding. Did they give you a list of signs and symptoms of hypoglycemia? Were they able to demonstrate appropriate insulin administration by reading a sliding scale correctly if they were given a fictitious number? So you want to document that. You want to describe any potential problem areas or any problem areas that did arise during the teaching, because these are areas that are going to need to be addressed in future teaching so that the patient can resolve these issues. You want to describe any reinforcement that was done and any reinforcement that still needs to be done for this patient, so that if you go off and you're off for 4 days, the nurse that is following you knows where she needs to pick up so that teaching can be completed. And again, remember, you need to document objective data, and objective data that demonstrates that the patient and family learned. You need to document what visual aids were utilized and given to the patient. That way, if there's ever any question that they never went home with something, you've documented it, such as in that previous example that they were giving handout number 12. You need to document when the nurse is unable to teach and explain why. You know, that you were not able to teach because patient was too sedated from pain narcotics during their hospitalization, unable to teach because the spouse was not willing to allow the teaching to be done, so you need to document it and why. And be sure to document if your assessment of the patient indicates that his or her existing knowledge is adequate and requires no further teaching. You're covering yourself on this one, that you've covered everything and they've learned it all. So teaching is an integral part of the art of nursing. Patients are comfortable with nurses, and they will ask us questions way more frequently than they will their primary provider. So you need to be aware of those moments and be ready for that teachable moment whenever it comes. Thank you.